Pharmacy Skills Lab Communication Assessment. The actor in this video is a real student who was following a script. The following depiction does not reflect the student's actual communication skills.
Oh, hi there. My name's Derek Jorgensen. I'm here to pick up a prescription.
Yeah, absolutely. My name is Brittany. I'm a pharmacy intern here.
Oh, okay. Hi, Brittany.
Hi. You said your name is Derek. What's your last name?
Jorgensen.
Jorgensen. Okay, and what are you picking up today?
My pills?
Your pills? It looks like you have the Ramipril. Is that
Yes,
correct?
yeah, it's my blood pressure pills.
Okay,
Sorry.
yeah, absolutely. No worries. Okay, so since the last time you were in, has anything changed at all?
Like with my medications, you mean?
More or less, yeah.
Yeah. I don't think so, no.
No, anything changed with any of your blood pressure at all?
I don't think so,
No?
yeah, no.
Have there been any new medical diagnoses since last time?
Well, I get this every month, so I don't know if it's last time, but recently my doctor told me I have arthritis. I don't know if that's kind of what you're getting at?
Yeah, absolutely, yeah. How long has that been going on for?
About a month.
About a month,
yeah,
okay. And you've seen the doctor for that, correct?
Yes.
Yes, okay. And have they recommended a product for you at all?
Well, yeah, not really. Like she said I have osteoarthritis.
Okay.
And said it's not serious, just go to the pharmacy and buy some pain medicine, and so that's what I did. So she didn't really say what to buy. I don't know, got what was on sale, you know.
Yeah, absolutely. And what is it that you picked up?
Ibuprofen.
Ibuprofen?
Yeah,
Okay.
400 milligrams.
400? And how are you taking that?
I take one of them like 2 or 3 times a day.
Okay. And has it been working for you?
Yeah, it's great. Yeah,
Okay.
yeah, it's awesome. Yeah.
Okay, I'll get into this a little bit more. Just actually with some of your medications, I think there are some better options for you.
Oh.
And we can discuss a little bit later on as well.
Like my blood pressure pill, you mean?
Yeah. Oh, not your blood pressure, but the ibuprofen.
Oh, okay.
It can actually sometimes raise blood pressure.
Oh.
Have you noticed at all since you started taking that, any increase in blood pressure at all?
Well, yeah, now that you mention it, yeah, it might be a little higher now, yeah.
Mm-hmm. Okay. And where is the arthritis in your body? Is it knees?
My knees, yeah.
Your knees,
Yeah.
yeah. We do actually have a topical product that I've had quite a bit of success with. I can show you after.
Oh.
And yeah, and that way there's no systemic, because you don't take a pill, it acts more locally, so it shouldn't have the same interaction as the ibuprofen and your current medication.
Oh, okay. I hope it works as good because, boy, my knees were so bad I couldn't play basketball anymore.
Yes.
And now it's just like,
Yeah, we can always try it out, and if it doesn't work, feel free to come back in the pharmacy. We can suggest something else as well.
Okay.
Yeah, or even give us a call as
Okay.
well.
Okay.
Getting back to the Ramipril, any new medications aside from the ibuprofen?
Nope.
No. Any new prescriptions?
Nope. Yeah.
Any new vitamins any new vitamins at all?
Vitamins? No. Yeah.
What about anything you can find over the shelf?
Just that ibuprofen. Yeah.
Okay, and how about any herbal products?
No. Yeah. Don't take any of that. Yeah.
Okay, sounds good. And so you've said the only kind of new medical condition would be the osteoarthritis.
Right. Yeah.
Any new allergies at all?
No.
No? Okay, sounds good. And as far as the Ramipril, how do you feel this is working for you?
I don't know. Like, I think it's okay. Yeah. I mean, I check my blood pressure every day, and it's like, yeah, usually good. Yeah.
Okay, do you have an exact number at all?
Number of what?
The blood pressure.
Oh, yeah. Like today, it was 138/85, I think.
Okay, that sounds good. And is that typical?
Well, that's a little higher. Like you said, you asked me before if it's been higher lately. That's a little higher. Like it used to be, I don't know, like 2-3 months ago, it was usually 130/80 or a little less even, and now it's, I don't know, yeah, like 138/85 today, and it's usually around 140 now.
Okay, yeah.
When I check in the morning.
Okay, how are you checking it in the morning?
What do you mean?
Has anybody, well, I guess what I'm actually asking is, has anybody explained to you how to check your blood pressure?
Yeah, like when I bought the machine here in the pharmacy, one of the other pharmacists gave me a sheet that explains, it says do it in the morning before you eat or drink any coffee, sit down with your feet flat and have your arm rested on a pillow above your heart. And so it's really useful. So I follow those rules to a T.
That's very good.
Yeah,
That's
I check it
excellent.
once every morning. Yeah.
Okay, and are you doing 3 readings in a row when you do that way?
No, I just check it once, yeah.
Okay, it is actually recommended, so you'll take it 3 times right in a row, and that first reading you take, you'll throw out, and then you just take the last 2.
Okay.
Yeah,
I
sometimes...
haven't been doing that, but I could do that.
Yeah, I'd recommend that as well. And too, sometimes if you, just with blood pressure as well, if you ever notice during the day that you have low blood pressure and you might feel lightheaded, I'd also recommend checking it then.
Oh, okay, yeah, that doesn't usually happen.
Yeah, so that's perfect. And that's actually another one of my questions as well. Have you noticed any side effects of this medication?
I don't think so. Yeah.
No? Okay, so no lightheadedness, like you said.
No.
Are you noticing when you go from sitting to standing any lightheadedness?
No.
No? Any dry cough?
No.
No? Okay. So no side effects, and I think it's working well for you. And I think once we switch from ibuprofen, your blood pressure might go down as well. So I'd still recommend
So is that
monitoring it.
dangerous? Like you said, my blood pressure is a little higher now, and I need to switch that medicine that's working so well for me. Is that, like, is 138
Yeah. I really
bad?
do.
Yeah.
I really do recommend switching. There have been some studies that showed even a 5-point increase can have some drastic effects just on long-term health effects, as well as there might actually be an interaction with your kidneys and your like your ramipril here and the ibuprofen as well.
Oh, okay.
So it's not the safest.
Sounds bad, yeah.
But with that being said, it can be done, but there are safer alternatives.
Okay.
So if the safer alternative is going to work for you and you haven't tried it yet, I recommend that.
Fair enough, yeah.
And then we can reassess from there.
Okay.
Does that make sense?
Yeah, sounds good. Yeah,
You're
thank
comfortable
you.
with it?
Yeah.
Okay, perfect. And do you mind telling me how you're taking this medication?
The ramipril, I take it once a day in the morning. Yeah.
How often do you find you're forgetting to take it?
I don't think I ever forget. Yeah.
That's
I've
really
got it in the kitchen by my coffee pot, and so yeah.
Okay, excellent. That's awesome. Any other questions for me at all?
I don't think so.
No? Okay.
Very thorough, yeah.
Okay, perfect. It sounds like this is working well for you, and have a great month, and I'll see you again.
Okay.
And if you have any questions after I show you this diclofenac, you can
Oh, that's
phone
the cream?
Yeah, so it's actually called, so that's the drug name, and it's actually a Voltaren rub.
Okay, so we'll go get it now.
Yeah.
Okay, thank you.
The feedback provided in this video is comprehensive. In many situations, it may not be feasible or practical to provide such comprehensive feedback to a learner. Assessors should aim to provide the most comprehensive feedback possible with the time available, focusing on the most important aspects of what went well and what should be improved. Let's take a look at the feedback that would have been provided to this pharmacy student. Here's what went well for the student. The student's verbal communication was organized and clear. The conversation flowed naturally and logically from one point to the next. For example, after discussing proper home blood pressure measurement technique, she moved logically into asking about common side effects of his antihypertensive. The student used language, pace, tone, and nonverbal cues which were suitable for the context. She had an extremely friendly, open, yet confident demeanor and approach that appeared to put the patient at ease and probably led him to being comfortable to ask her questions when he was unsure of something that she had said or when he had a concern. She also used silence appropriately while waiting for the patient to respond, and she did not cut the patient off, which also probably encouraged his additional questions. She also maintained eye contact, and she did not have distracting gestures. The student caught herself twice almost using medical jargon such as systemic exposure and ACE inhibitor, but she corrected herself before finishing the word both times. This is included as something that went well because it shows that the student is self-monitoring and has the ability to correct herself. If students are able to catch themselves using medical jargon and change the terminology appropriately, this is not a reason to penalize the student. The student used the patient's cues to guide the conversation and used them to explain things further based off of the patient's reaction. For example, near the end, the patient was clearly unsure about switching his arthritis medication, and she did a good job of explaining this to him and alleviating his previously unaddressed concern. Here's what could have gone better. The student could have introduced the reason for the counsel. Keep in mind that this is actually a part of the content assessment rubric and should be noted as an omission related to content. However, since this omission led to the patient acting confused as to why she was asking questions, it is also something that could be mentioned to the student when providing feedback on communication skills. The student displayed a lack of empathy at times. For example, the patient initially told her that the ibuprofen was working great, and she then later suggested that he switch to a different product without acknowledging that he was very happy with the ibuprofen, without providing detailed rationale for why she wanted him to switch, and without asking him what he thought about the suggestion. She was lucky that near the end of the interaction, the patient raised his concern and asked her to better explain the need for the change. This is probably because of her strong communication skills making him comfortable enough to ask for more detail. She was eventually able to better explain her recommendation and alleviate his concern. If the patient had not initiated that final conversation, he likely would have left feeling like she had not really listened to his preferences or concerns. The student did not use the most suitable language at times. When discussing the slight increase in blood pressure, the student used the phrase, "drastic effects on long-term health," which could have scared the patient. Also, at the end of the counsel, the student made a comment regarding the ramipril, saying, "It sounds like this is working well for you," soon after having the conversation about the fact that his blood pressure was high, which may have been a confusing contradiction to the patient. Some of the questions that she asked were imprecise and the patient needed to ask for further clarification. For example, she asked, "Do you have an exact number?" And "How are you checking your blood pressure?" And "Has anything changed since last time?" which all confused the patient slightly. Finally, she also confirmed something that the patient had already stated, which made it seem like she was not listening attentively. This occurred when she said, "So you've been to the doctor about this, correct?" when earlier in the counsel the patient had already revealed that he had been to the doctor about his knee pain. This student was awarded a communication achievement score of P, proficient. Most of the things that could have gone better in this interaction were minor and would have not significantly impacted the patient's experience or understanding except for the issue related to empathy. The student's extremely friendly, open, yet confident and organized approach allowed her to significantly reduce the negative impact of her initial lack of empathy regarding the suggested change of his arthritis medication. Her strong verbal and nonverbal communication likely made the patient comfortable and willing to prompt her about his previously unaddressed concerns. Had the patient not prompted her to do this at the end of the session, the interaction likely would have not ended as positively, and the patient may have gone away feeling like she was not listening to his concerns, and may have not stopped taking the ibuprofen as recommended, probably justifying a communication score of G, or growing. Conversely, had the student proactively used good empathetic communication skills at the start, perhaps by saying something like, "I understand that you are very happy with how awesome the ibuprofen is working, and that you'd prefer to keep using it. That makes complete sense, and I would normally suggest that you don't change anything. However, there is an interaction between the ibuprofen and your blood pressure medication, which probably explains your higher blood pressure this month. This isn't a problem in the short term, but it can increase your risk of heart attack or stroke in the long term. What if I told you that I could give you something different than ibuprofen, but something that will work probably just as well and will not interact with your blood pressure pills at all? Would you be interested in giving that product a try, even for just a couple of weeks?" The bottom line is that when all things are considered, the student's performance related to communication was at the level expected of a typical pharmacist, so we'd assess her communication skills as being P, or proficient.